From the Daisy nominations received during the month of June, the winner is Jill Roberts. Before I proceed with the rest of the program, I would like to introduce Jill's sister, Deanie Ditzenberger, and her best friend, Linnell Clausen, who have made a special trip from Dallas and Texarkana to be here for this, as well as many of her other friends.
I bet you couldn't tell she was my sister.
Here are the nominations that got Jill elected for the Daisy Award. The first one was received in December of 2013, and it reads as follows. Jill is a pleasure to work with. She is always busy trying to do what is best for her patients. She is very helpful and easy to talk to. She has excellent communication skills and serves as a bridge between the physicians and other departments, including pharmacy. As a pharmacist, I understand that physicians are busy and have many important things to do for their patients. Some of the medication issues that are important to us as pharmacists may not be as high on their minds, and rightfully so in most cases. This nurse serves to bridge the gap and communicates the concerns and recommendations we have to the physicians. I do not know what we would do without her. She is a very valuable member of the team, always willing to take time to listen. She exemplifies many of the service standards Trinity Mother Frances stands for. She embodies effective communication, teamwork, and responsiveness, but also accountability and fostering a patient-centered culture. I am proud to nominate this nurse for the Daisy Award, BN Coworker. The second one was received in June of 2014. I have been thinking of writing this nomination for several months. It is long overdue, and when you talk to the staff in my department, they're in 100% agreement. The nurse I'm nominating is the ACNP for our trauma surgeons. She is what I describe to patients and families as, quote, their left hand, end quote. Truly, our program would not be nearly as efficient or exemplary without Jill. Although she is a nurse practitioner, Jill has never forgotten she's a nurse first. She cares for her patients and the nurses caring for them. She cries for them. She cries with them. She is aggressive when needed and recognizes when it's time not to be. She is thorough with all her assessments and chart reviews. She has caught multiple missed labs, medications, etc. that have improved the care of the patient. She is a strong advocate for her patients and is a great liaison to us as nurses with the physicians. I know she has stayed late multiple times to care for the patients. I feel at peace when she's around because I know that I have a person I can still call with anything. I can remember a patient, symptomatic and bleeding out. Level 1 blood infuser going. The patient was dumping blood out of his chest tubes equivalent to what we were putting in. This nurse didn't leave. She ordered what was needed to save his life. The patient was a young man. This nurse does this on an everyday basis. Our nurses on our unit are always grateful for her. She deserves so much credit for her dedication. So many patients are alive or have decreased hospital stays because of her. I hope and pray this nurse will receive this award. She, in my eyes, and the unit could receive this award each month. We thank her, probably not enough. We love her. I love her. I look up to her and hope one day I will leave the legacy she is creating on a daily basis. LL Coworker. One other note, on a personal note, all 4 trauma surgeons could probably echo this. She is the glue that keeps us together. She is the oil that makes things run smoother. And she's the sandpaper that makes us nicer people. And we appreciate and support this.
It's a course grade.
I've always wondered how a daisy could grow in a briar patch with a bunch of cucumber around it, but it certainly does.
Thank you. Thank you.
And now it's my pleasure on behalf of the Daisy Foundation to proclaim you, Jill Roberts, a Daisy Award Extraordinary Nurse. Here's your award certificate. And I'm supposed to read this to you because I think you can't read it because I think I have your glasses. The Daisy Award for Extraordinary Nurses. This award is presented to Jill Roberts, MSN, RN, ACNP. You should have a lot of other things after this too, but in deep appreciation of all you do, who you are, and the incredibly meaningful difference you make in the lives of so many people.
Thank you.
You're very welcome. Now I'm supposed to put a pin on you. This is like going to the
prom.
The prom. So both of us are a little too old for that.
Why don't you? Thank you.
All right. All right. Now we're supposed to unfurl a banner. Okay, watch the unfurling. There we go. And you get the ever popular parking pass, which I understand you're going to auction off.
I am. I am.
Now a message from the Daisy Foundation. By definition, the Daisy Foundation thinks all nurses are extraordinary, and we wish we had the resources to honor all of you individually. Nurses who receive the Daisy Award often say, everyone in the unit deserves this award as much as I do, or I don't deserve this. I was just doing my job. What the Daisy nurse may not realize, however, is that nurses are just doing their jobs. They have such important and meaningful impact on the lives of so many people, many more than their patients. Every Daisy Award presentation, we ask each nurse to pause for just a minute and realize how very special they are and how they make the world a better place by just doing their jobs. Today, a nurse's job entails many things, but no matter what the day brings, a nurse's impact is invaluable and long-lasting to their patients and their families. Thanks to your dedication and training, your commitment and judgment, your compassion and connection with your patients, you are very special. You make the world such a better place by just doing your job. The skill and compassion you bring to patient care makes a patient's outcome more positive or makes a family member feel a little better that they are better able to help with the patient's healing. Please think about the impact you are having. Story after story brings this to light. I would encourage you to look at the National Daisy website and read the stories. The link is on Nursing Public. Prior to our closing prayer, I want to give a special thank you to those who nominated Jill. This award does not happen unless you take time to write the nomination, and it means a great deal to you that you care enough for Jill to do this. Thank you for choosing a career in nursing and for the skill, care, and compassion you give to your patients every day. And to Jill, congratulations.